Tough economic conditions and the pressures of health reform and budget cuts by government have created a difficult environment for all healthcare organizations.
As a result, tough and contentious negotiations between payers and providers are more and more common.
We've helped in more than 350 such negotiations over the years. We know exactly what ingredients are required for success.
It takes 5 things: clarity, resolve, strategy, story, and discipline.
We help health systems, physician groups, and specialty providers put those ingredients together and win.
Clarity requires that you know the facts about the negotiation landscape. What do you need for rates and language?
What is your BATNA? What are the payer's biggest priorities? What does the redirection analysis show? And how will cash flow be affected if you end up out of network? Clarity comes first because the other ingredients cannot come together without it. Consider clarity the yeast in the bread.
Clarity should produce resolve, and resolve drives everything else. Ask yourself, how much pressure can the board endure? Will physician leadership remain supportive if the contract ends? Ultimately, it all comes down to this: is the juice worth the squeeze? If not now, will it be easier in 2013, 2014, or beyond? We have every reason to believe it's only going to get tougher and tougher.
Mapping your strategy is key to controlling the agenda of debate and winning. You must understand each payer's unique playbook, determine the best approach, proactive or reactive, and determine the pivot points for escalation. The key is to engage and activate, not just inform.
Every payer situation comes down to 2 factors. 1, how do we keep the physicians with us? And 2, how do we peel the employers away from the payer?
Executing the strategy depends on your ability to tell your story. We must understand the perceptions in the community, especially in the employer and broker communities. We must communicate our value, validating it with cost and quality data. We have to explain what we need and what the payer demands. Then we have to go tell that story to all key audiences.
Disciplined execution of the strategy, supported by resolve, will help you win. Our approaches bring together your negotiating strategy, business strategy, and a highly effective communication strategy. Too many strategies are derailed by second guessing and worry. We keep your plan on track with disciplined execution. No matter what the payer does, or their false promises of resolution if you unilaterally disarm,
we create the leverage and the pressure you need to win. Protect your reputation along the way.
When you need to win, when you can't afford to lose, think Revive Health.